Hi, welcome to Nursing Manthra Academy online crash course for nurses. Medical Surgical Nursing. Respiratory system disorders. So now here we are going to discuss regarding adult and pediatric respiratory disorders. Before going through the respiratory disorders, we should know the lung anatomy. So the lung anatomy and physiology are mainly the functions of the respiratory system. The lungs are primary functions and secondary functions are there. The primary functions means it provides the oxygen for metabolism in the tissues and removes the carbon dioxide, that is the waste product of metabolism. Secondary functions of the lungs are facilitate sense of smell, the complete respiratory system function we are going to discussing, and it produces speech, maintains acid-base balance, maintains body water levels, maintains heat balance. These are the secondary functions of the respiratory system. So we have upper respiratory tract and lower respiratory tract. In the upper respiratory tract, we have the nose, sinus, pharynx, larynx, epiglottis. And in the lower respiratory tract, we have the trachea, then main stem bronchi, and the bronchioles, then alveoli. All these are then lungs, accessory muscles of respiration. Okay, these are the things will be coming for this anatomy. So in the upper respiratory tract, the nose, as you know, that it humidifies and warms and filters the inspired air. Sinuses means air-filled cavities within the hollow bones that surround the nasal passage and provide resonance during speech. Pharynx, as we know, okay, the pharynx, that is a passageway for the respiratory and digestive tract located behind the nasal and oral cavities. Pharynx is divided into nasopharynx and oropharynx. Then next is larynx. The larynx above the trachea, just below the pharynx, at the root of the tongue. Larynx contains two pair of vocal cords, the false and true cords. The opening between the true vocal cords is the glottis. Glottis plays an important role in coughing, which is most fundamental defense mechanism of the lungs. So coughing is the most fundamental defense mechanism of the lungs. Now we can see the epiglottis.
If you wish to know more details about this book, feel free to contact me in WhatsApp. WhatsApp link I mentioned in description box.
So the epiglottis, it is a leaf-shaped elastic structure attached along one end to the top of the larynx. Prevents food from entering the tracheobronchial tree by closing over the glottis during swallowing. In the lower respiratory tract, we have mainly trachea. Trachea is located in front of the esophagus, branches into the right and left main stem bronchi at the carina. So, the main stem bronchi, it begins at carina. The right bronchus is slightly wider, shorter and more vertical than the left bronchus. The main stem bronchi, again it is dividing into secondary and lobar bronchioles. Lobar bronchi that enter each of the 5 lobes of the lungs. The bronchi are lined with the cilia, with which propel the mucus up and away from the lower airway to the trachea, where it can be expectorated or swallowed. Then again this bronchi, it will be again dividing into bronchioles. You can see here bronchioles. So bronchioles branch from the secondary bronchi and subdivided into small terminal and respiratory bronchioles. Bronchioles contain no cartilage and depend on the elastic recoil of the lung for patency. The terminal bronchioles contain no cilia and do not participate in the gas exchanger. So again, these bronchioles will reach into the alveolar duct and alveoli. Acinus is the term used to indicate all structures distal to the terminal bronchioles. Alveolar ducts branch from the respiratory bronchioles. Alveolar sac, which arises from the duct, contains clusters of alveoli, which are the basic units of gas exchange. So alveoli are the basic units of the gas exchange. Type 2 alveolar cells in the walls of the alveoli secrete surfactant, a phospholipid protein that reduces the surface tension in the alveoli. Without surfactant, the alveoli would collapse. So there will be secretion of the surfactant, and surfactant will be there in the alveoli. So now we can see the lungs. Lungs, it is located in the pleural cavity in the thorax, extended from the just above the clavicle to the diaphragm. Right lung, which is larger than the left, is divided into 3 lobes. So right lungs, it is divided into 3 lobes, and the left lung is having 2 lobes. So the lobes, the right lung lobes, upper lobe, middle lobe and lower lobe. The left lung, which is narrower than the right lung, to accommodate, because there is a heart, there will be 2 lobes only. The place will be there for 2 lobes, upper and lower lobes. Respiratory structures are innervated by the phrenic nerve, vagus nerve and thoracic nerve. All these nerves functioning in the respiratory structures. Parietal pleura lines the inside of the thoracic cavity, including the upper surface of the diaphragm. So the parietal pleura will be there. You can see the pleura here and the pleural fluid. Okay. So the visceral pleura covers the pulmonary surface. A thin fluid layer, which is produced by the cells lining the pleura, lubricate the visceral and parietal pleura, allowing them to glide smoothly and painlessly during the respiration. So during the respiration, there will be lubrication between the visceral and parietal pleura. Blood flows through the lungs via the pulmonary system and the bronchial system. And another important thing is for the accessory muscles of respiration, scalene muscle, sternocleidomastoid muscle, trapezius muscle, pectoralis major and minor. These are the muscles which will help, accessory muscles which will help for the respiration. So now here we can see the alveoli and the structures. Okay, the nasal cavity, pharynx, larynx, bronchiole, bronchi. All these are the conducting zone, and the respiratory zone we can see that alveolar duct and the respiratory bronchioles, alveoli and all. So exchange of the oxygen and the carbon dioxide is taking place inside the lungs. So the respiratory tract, as we discussed, it is divided into upper respiratory tract and the lower respiratory tract. So upper respiratory tract, nasal cavity, then pharynx, larynx, and as lower respiratory tract, we can say the trachea, bronchioles, and bronchi, alveolar duct, and all it will be there. Weight of the lung, it is about 1.3 kg and contains almost 2000 km of airways, 2500 kilometers of airways it contains. So lobes of the lungs, okay, right side, right lungs lobes, three division will be there, and left side it is 2 divisions will be there, as we discussed before. There will be fissure dividing the lobes. So the supply of the blood circulation is taking place, and through this pulmonary artery from the heart, the blood is coming towards the lungs. In the alveoli, gas exchange taking place, and the blood will become oxygenated, and through the pulmonary veins, the oxygenated blood will reach into the left atrium. So this cycle will be happening for the circulation. So here we have a primary lobule acinus. So in the alveolar sac, this is alveolar duct and the respiratory bronchioles. So these air sacs, we are calling it as alveoli. So gas exchange is taking place. 300 to 500 million alveoli in the lungs provide a huge surface area for gas exchange. So it contains elastic fibers. So there will be pulmonary circulation, and the bronchial circulations will be there. So pulmonary artery and the pulmonary veins. Pulmonary artery carries deoxygenated blood, and pulmonary veins carries oxygenated blood. So you can see the intercostal muscles and the diaphragm area, relaxed diaphragm. Well, you can see here the diaphragm is relaxed, and diaphragm is contracting and relaxing. As we have seen, alveolar sac, regarding the alveolar sac, it contains the capillaries that supply the pulmonary artery. We discussed already, it will be carrying the unoxygenated blood to the lungs to receive the oxygen, and the pulmonary veins which takes the oxygenated blood back to the heart. These capillaries have a thin membrane that allows the transport of oxygen and carbon dioxide. Now we can see the lung sounds.
If you didn't subscribe Nursing Mantra YouTube channel until now, please subscribe now and enable the bell icon to get the updated notifications.
So the lung sounds, different types of lung sounds are there. So coarse crackles will be there, wheezing will be there, rhongi, pleural rub, fine crackles, stridor. So the coarse crackles means low pitched sound, bubbling or a gurgling sound. Coughing won't clear. Wheezing means wheezing is like a musical sound. Inspiration and expiration, sound will be the high pitched sound, and it is a continuous sound. Rhongi means sonorous wheeze. Inspiration and expiration also caused by secretions. It will clear with the coughing. Snoring sound, and it is continuous sound will be there. Respiratory stridor means it is high pitched inspiratory sound, and upper airway issues will be there because of that respiratory stridor. Fine crackles. Crackles means that a popping sound will be there, like a wood burning sound. This continuous it will be. And pleural rub means leather sounding, dry grating sound, inspiration and expiration. Pleural rub, leather sounding, dry grating sound, and it will be, we can hear during this inspiration or expiration also. Now we can hear some of the breath sounds. First one is bronchial breath sounds. That is bronchial breath sound. Now you can see crackles. That is coarse crackles. Fine crackles. there is a diminished breath sounds. Now expiratory wheezing. Now we can hear the pleural breath. Next is rhongi. This is rhongi sound. Respiratory stridor. Vesicular breath sounds. That is about the lung sounds. And the respiratory process, as all we know that there will be inspiration and expiration will be there. During inspiration, the diaphragm descends into the abdominal cavity, causing negative pressure in the lungs. Negative pressure draws air from the area of greater pressure, the atmosphere, into the area of the lesser pressure, the lungs. In the lungs, air passes through the terminal bronchioles into the alveoli to oxygenate the body tissue. Like that, inspiration is happening. During expiration, at the end of the inspiration, the diaphragm and the intercostal muscles, what they are going to do, they will relax and the lungs will recoil. The pressure within the lungs become higher than the atmospheric pressure. So, causing the air which contains the cellular waste product carbon dioxide and water to move from the alveoli in the lungs to the atmosphere. That is happening during expiration. Some of the terms used in respiratory system. What is apnea? Apnea means temporary cessation of breathing. Cessation means stop. Temporary cessation of breathing, that is apnea. Compliance means measure the force required to expand or inflate the lungs. Compliance means the force required to expand or inflate the lungs. That is the measurement. Crackles means, now we heard the crackle sound. That is a soft, high-pitched, discontinuous popping sound during the inspiration, caused by delayed reopening of the airway due to some of the disease conditions. Dyspnea, that means subjective experience that describes difficulty of breathing and shortness of breath. The patient will complain there will be difficulty of breathing and shortness of breath, that is dyspnea. Hypoxemia, that means decrease in the arterial oxygen tension in the blood. Hypoxia means decrease in oxygen supply to the tissues and the cells. Obstructive sleep apnea, temporary absence of breathing during the sleep, secondary to transient upper airway obstruction. What is fremitus? Fremitus means vibration of speech felt as tremors of the chest during palpation. Hemoptysis means expectoration of blood from the respiratory tract. Blood from the stomach, the pH is acidic. Blood from the respiratory tract with the mucus secretion, the pH will be alkaline pH.
Continuation of this video and more system-wise crash course, feel free to contact Nursing Manthra. WhatsApp number +971 5025 15717. Please check the description for WhatsApp link. DHA, MOH, HAAD, Saudi Prometric, Oman Prometric, Bahrain Prometric, Qatar Prometric, nclex-rn, CBT exam. We are providing system-based crash course videos. Respiratory system, cardiovascular system, ENT system, ophthalmic system, nervous system, gastrointestinal system, urinary system, reproductive system, musculoskeletal system, endocrine system, dermatology, child health nursing, maternal health nursing, community health nursing, mental health nursing. Fundamentals of nursing includes calculations, nutrition, research and statistics. Online crash course. Anytime you can study with an internet connection. For reference, you can watch system-based crash course videos in Nursing Manthra YouTube channel. For full detailed crash course video with picture, feel free to contact me in my WhatsApp.